Good morning to all of you wonderful people that stumbled across this video, since it means that you wanted to learn more about what maintains our health in these trying times. Well, good news, I'll get started for you right now since it is our topic for today. This is called the Republic Act number 11223. This act shall be known as the Universal Healthcare Act, be it enacted by the Senate and House of Representatives of the Philippine Congress assembled. The Universal Healthcare Act was approved by former President Rodrigo Duterte, other Senates, and House of Representatives on February 20, 2019. This act states that all Filipino citizens, no matter what age, no matter if you have a family or not, are automatically PhilHealth members. That's right, me and you, all of us as Filipino citizens, are now PhilHealth members. We now have PhilHealth benefits. This means all Filipinos are covered from paying their medicine and health services and will not suffer from financial catastrophe, since all of those are now freely accessible, affordable, and of good quality, meaning you won't have to worry about your medicine being of low quality anymore. So whenever you're sick or whenever you have financial troubles, you won't have to worry because, first of all, it's going to be paid for, and second of all, you are going to have so much to save because you are going to have the budget now to afford it. Now, the Universal Health Care Act ensures that everyone, from barangay workers to the national level workers, will be following a certain and precise framework on how the services are going to be delivered. Uh, this is also hoping that this act will not get abused and will instead provide fair and impartial services to all. So people need not worry about them not getting their medicine or getting abused because it will be okay because the law ensures that it will. For the longest time, the Universal Health Care Act started off as an advocacy, a protest of people wishing to have affordable and available health care without worrying about financial distress propagated by the Universal Healthcare Study Group. So it was a wish. It started off as a wish to some, and then it continued. It continued to be a thing people fought for. They wanted to break the notion that healthcare cannot be afforded by all, and wanted to change it. So, the Act includes regulatory reforms and mandatory maintenance to improve the quality of health services and everything else. Examples of these are the standardization of health benefits for the workers and regulation of healthcare providers for everyone. Now then, who does this act benefit exactly? Well, generally they benefit a lot of people. However, they are mostly categorized as these. First, low-income families who doesn't have access to medicine or any health services now have access to free or subsidized health services. Subsidized meaning it is financially supported, so you won't have to worry about the payment or anything at all. But we'll get there in a second. Second, rural communities that have seen improvements in health service delivery. This happened through increased funding and infrastructure support, meaning that deliveries are now going smoother and safer, and the deliveries itself are now made safe, and the packages arrive in one piece to their destination. Lastly, patients diagnosed with chronic illnesses who now receive regular and affordable medical care and medications to have a fighting chance against aforementioned illnesses. The Universal Health Care Act means it focuses on the preventive aspects of the health system, which means preventing disasters by providing a better working and living living environment to kids, teens, and workers, so they will be able to live safe and be safe. In order to ensure continuity, reduce duplication, and truly be able to provide efficient services, primary care providers will be assigned for each family. That's one of the meaning for universal health care. However, be mindful, as this does not mean that everything will be free. This is where the saying health spending is predictable, not free. That's where the phrase comes to mind. It means that people should spend their money on what they can, and thankfully, it is provided that it can be provided with a manageable budget, but not free. And to prevent the citizens from being shocked in the first place for these prices, the prices will be made transparent. We do away with the idea that everything is free through dole-outs, and instead, health spending is made predictable for each patient. So everyone in their right budget will be able to afford it without abusing it, you know? Now, what does this mean for hospitals? Government hospitals or public hospitals are required to have 90% of their bed available for basic accommodation. Basic accommodation is where they put at least 6 up to 20 beds in one room. I personally haven't experienced this before, but I can guess this is tight. And this is where people who need care and most people generally get their treatment, while private hospitals are required to have at least 10% of their authorized bed capacity as basic accommodation. So, public hospitals are well suited for people with immediate need for care, and private hospitals are for those who can afford it still with their budget. Technically speaking, public and private hospitals both are there for people who are in immediate need of care. It's just that public hospitals are more well accessed than private. Now, in Section 28, affordability in terms of prescribed markup for drugs, medical devices, and supplies, here it is. And I'm not going to read all of these, but basically it means that first, the Department of Health, the DOH, will set rules for how much DOH owned health facilities can mark up the prices of drugs and medical devices and supplies. So, meaning people cannot put the prices of the medicine to a higher number than what the DOH will. If they do, then we're going to get to that in a second. Second, these facilities must give the DOH the necessary cost information to create these rules, and they must follow them. These information will be used in determining payments, as it is mentioned in for the next section, which is that PhilHealth will use these rules to determine payments, like I just said, so that they can determine the payments while considering the budget of the people, while also maintaining the businesses that run and give the medicine. If the facilities do not follow these rules, like I said before, they will face penalties according to existing laws. So, in conclusion, overall, the RA 11223 aims to transform the Philippine healthcare system to be more inclusive, accessible, and efficient, meaning the new law helps more Filipinos get health services by automatically enrolling everyone in PhilHealth's National Health Insurance Program. This means that all Filipinos can access a wide range of health services without worrying about the cost, without worrying about if they're still going to survive even after buying the medicine. The goal of this is to make sure everyone can get the care they need, from basic checkups to serious treatments, without facing financial problems. None at all. Like, imagine that you guys just want to get a checkup, but then you find out that you have something serious going on inside you, and now you need to buy all this medicine, and you think it's going to cost you a fortune, but thanks to this new law, it won't. Basically speaking, this law is a big step towards making healthcare fair and available to everyone in the Philippines, ensuring that every Filipino has access to the healthcare they need without financial hardship. Thank you so much for listening to me talk. I hope you guys learned something, and I hope that I will be able to provide you with more information in the future. Thank you.
Ah, ano po ang name nila?
Nora Samson Benifalo.
Ilang taong gulang na po?
51 na ako ngayon.
Kayo po ba ang may karamdaman po?
May sakit ako, high blood, mataas ang sugar, tsaka ano, may bato sa akdo.
Gano'ng katagal na po kayong may sakit?
Na, 15 years.
Sa mga anak po ninyo may sakit din po ba?
Wala naman. Si yung bunso ko, siya, tiptoe.
May PhilHealth po ba kayo?
Meron akong PhilHealth dati. Pag kailangan, nagagamit naman.
Alam niyo po ba ang batas na Universal Healthcare Act?
Hindi eh.
So, ipapaliwanag ko po kung ano yung Universal Healthcare Act. Ang Universal Healthcare Act o RA 11223 ay naglalayong magbigay ng healthcare coverage sa lahat ng Pilipino sa pamamagitan ng otomatikong pag-enroll sa National Health Insurance Program at PhilHealth. Tinitiyak nito na bawat Pilipino ay may access sa komprehensibong mga serbisyong pangkalusugan tulad ng preventive, promotive, curative, rehabilitative at palliative care. So far, ano po ba ang naitulong sa inyo ng batas na ito?
Nung kailangan ng bunso na operahan, nakatulong naman siya. Nagamit ko yung PhilHealth ng 10K
10K po, naibawas sa...
na ibawat sa...
So, nagagalak po ba kayo na naipatupad ang batas na ito?
Siyempre,
Bakit po?
malaking halaga rin yung nabawas sa, sa bills.
So, ano po ang name nila?
Banji Samson.
Kayo po ba ang may karamdaman po?
Hindi po, yung asawa ko,
So, ano po yung name din po nila?
Jerry Gahodo Samson.
Ano po ang karamdaman ni Sir Jerry po?
Nagpa-opera po siya sa mata, sa eye center.
May PhilHealth po ba siya?
Meron po.
Alam niyo po ba ang Universal Healthcare Act RA 11223?
Hindi po.
So, papaliwanag ko po ang Universal Healthcare Act. Ang Universal Healthcare Act RA 11223 ay isang batas na nagbibigay ng healthcare coverage para sa mga lahat ng mamamayang Pilipino. Layunin nitong otomatikong i-enroll ang lahat ng Pilipino sa National Health Insurance Program at PhilHealth na tiyakin na ang bawat Pilipino ay may access sa kumpletong access ng mga comprehensive range of health services. Kabilang ang preventive, promotive, curative at rehabilitative at palliative care. So, ngayon po na alam nyo na po kung ano yung Universal Healthcare Act. So far, ano po ba ang naitulong sa inyo ng batas na ito?
Malaki po ang naitulong kayo dahil nabawasan po ang aming bayarin sa ospital.
So, nagagalak po ba kayo na napaipatupad ang batas na ito?
Opo.
Ano po ang name nila?
Sarah Samson,
Ilang taong gulang na po?
37.
So, may karamdaman po ba kayo?
Wala.
Meron po ba kayong PhilHealth po?
Meron.
Saan niyo po ginamit po yung PhilHealth po?
Nanganak ako.
Ilan na po ba ang anak niyo po?
2.
Saan niyo po dun sa dalawang anak niyo po ginamit?
Bunso. Pangalawa.
Alam niyo po ba ang Universal Healthcare Act?
Hindi.
So, papaliwanag ko po ang Universal Healthcare Act. Ang Universal Healthcare Act, RA 11223, ay naglalayong magbigay ng healthcare coverage sa lahat ng Pilipino sa pamamagitan ng otomatikong pag-enroll sa National Health Insurance Program at PhilHealth. Tinitiyak nito na ang bawat Pilipino ay may access sa komprehensibong mga serbisyong pangkalusugan tulad ng preventive, promotive, curative, rehabilitative at palliative care. So far po, ano po ba ang naitulong sa inyo ng batas nito?
Yung pagbaba ng bill.
Nagagalang po ba kayo na naipatupad ang batas nito?
Oo. Oo.
Bakit po?
Uy, nakatulong sa mga mahihirap na hindi kaya magbayad ng mga bills.
For the official National Weather Service forecast for eastern Massachusetts incited by 495, including Boston, issued at 7:21 p.m., Thursday, October 22nd. Tonight, mostly cloudy with isolated showers until midnight, then mostly clear after midnight. Lows in the lower 40s. West winds 10 to 15 miles an hour with gusts up to 25 miles an hour.